it's Bree Van Leeuwen from Here's to Healthy Women. You can call me Bree. For those of you that aren't familiar with my channel, I am a physician assistant, a PA, who works as a surgical PA in two different specialties, one in urologic surgery and the other in cosmetic and reconstructive facial plastic surgery. So I'm really excited about today's topic because A, it's specific to my field, and B, because you guys keep asking all of these same questions, and that makes me excited to be able to deliver information that's hopefully helpful to all of my pre-medical, pre-PA students out there. So the question is, for this video, what exactly does a surgical PA do? That's what everybody keeps asking me. I've gotten a lot of direct messages and emails and comments on my YouTube channel and some of my Instagram about this, so I'm happy to answer it. A surgical PA, like any PA in general, I look at as a physician extender. At some point, they were actually going to change our name to be a physician extender, and I think that they're still attempting possibly to do that, but there's a lot of logistics and costs that come with that, so I don't know that it will actually ever turn out, but I like the name physician extender a lot better than physician assistant because in essence, I feel as though I'm an extension of the physician that I'm working for. So obviously what that means is you need to choose a physician that you have the same working behavior as, right? So you need to choose a physician that you appreciate their style of work, you appreciate how they handle patients, how they treat patients, because obviously no one's going to agree with another person 100% of the time. You're not meant to be a copycat of your physician, but you should have a good working relationship where the basic fundamental belief system of the way you practice medicine is the same. And in the cases where I've seen jobs not work out well for PAs is when that doesn't align. So when you're interviewing for jobs, ask some tough questions, make sure that you understand what you're getting into, and sometimes you don't. Sometimes you get into it and realize that the way that that doctor practices isn't the way that you want to practice, and that can be a little bit of friction and a cause of disruption. So try the best you can to find somebody that you feel like works the same as you. Now, because we were trained in a medical model, nurse practitioners are trained in a nursing model, physician assistants are trained in a medical model, and what that means is that we are allowed to perform any task or procedure that the supervising physician can perform, as long as it's in your delegations of service agreement, which is something you don't really need to know about until you start working, but a delegation of service agreement is something that the physician and you have agreed upon as the tasks that you can perform while you are a PA for that physician. And as long as you have agreed upon this delegations of service, that is your allowable list of things that you can do as a PA. Now, in surgery, what does that mean specifically in surgery? As a surgical PA, you are someone who sees the patient from end to end for a surgery. So you see them initially, usually up first. So in my practice, I see the patient oftentimes very first in the first contact in our office. So I will evaluate them, triage them, see if they are a surgical candidate and if they need the care of the surgeon or the physician. Then before the surgery in pre-op, you're doing all of, the pre-op notes and orders, and you're going through their history, signing all the paperwork, getting them ready for surgery in the pre-op room. Then in surgery, you're actually working alongside the physician. Now, most cases, the surgical PA acts as a first assist, meaning they're helping the surgeon perform the surgery. They're not independently doing the surgery. If you want to independently perform surgeries, you should be a surgeon. You should go to medical school, do the residencies that are required, and be the surgeon, because you will never be happy as a surgical PA, because that is not the role that's intended for a physician assistant in surgery. A physician assistant in surgery does perform a great deal of procedure and work and tasks during surgery, and it's not just retracting, it can be very involved. And for me, it's been very fulfilling and more than enough for me to feel like I'm a huge part of the OR. But I do not independently operate on patients. I don't know of any PAs that do that. Now, procedures in the office and surgeries are two different things. So I'm just specifically discussing surgical cases where the patient is under general anesthesia not, local anesthesia in the office where you're doing stitches or vasectomies in some cases. I know a lot of PAs perform, their own vasectomies in the office. I'm not talking about that. I am talking about general anesthesia, major surgeries. I don't know of any PAs that are independently operating on patients. Theoretically, if it was in your delegations of service agreement and your physician had that much trust and faith in you, and you were, abiding by the laws, I suppose you could, but I wouldn't go into being a surgical PA with the mindset that you will be the lead surgeon, because it just won't happen. So, but what you are allowed to do, and what you most commonly will do, is open the patient. You help during it. So I did a lot of my surgical training at the Brigham and Women's Hospital in Boston, Massachusetts. And that hospital has a lot of Harvard medical team there. That's who does all of their, that's where the Harvard medical team does all of their rotations. So I did my plastic surgery rotation there and my orthopedic surgery rotation there. So I was involved in a great deal of surgery. And there they use PAs a lot more than they do in some other states. So PAs there are used almost, like I said, as an extension of the physician. So the physician will do something, the PA will do something. In one of the cases I saw, the surgeon was doing a knee and then the PA was doing the other knee. So it can be very involved, very advanced work in the operating room, but that relationship and the ability for you to do that is solely based on how comfortable your physician feels with your abilities to work in the operating room. And the longer you're with a physician, the more comfortable they're going to be with you. The more you operate, obviously the more experience you have, the more they're going to allow you to do. But if you are the kind of person that doesn't want to be dictated by someone telling you can or can't do something, then you should not be a PA and you should pursue medical school and be a surgeon. So that's a big distinction, and you should know that going into it so that you have satisfaction in your job choice. Now, after the actual surgery, PAs often will close the patient and then help the room get turned over by doing post-op dictation. So when you take the patient to the recovery room, you're going to dictate the post-op notes sometimes, or write the orders, talk to the family, all of those tasks. And a good PA will stick around in the operating room and kind of help get things turned over for the next patient. It's never below you to help do work that you don't think is technically a PA role. It's not beyond a physician. I mean, the great physicians will help do that too if time allows for it, and a lot of them do, and it's very admirable and wonderful. Okay, so past that point, I will say that, and I've already said this, but a stellar physician assistant is someone who works just in beautiful synchrony with their supervising physician. That's when the relationship, and that's when this job works the best. After you see the patient in the PACU, when you take them to PACU and you talk to their family and you set up their follow-up appointments, oftentimes they will also be seeing the PA in the post-operative care setting. Now, there will be times that you are seeing the patient post-operatively and things are not going as well as you had hoped. And those are the moments, again, where you're triaging to assess and say, okay, do we need to get the physician involved here? Does the surgeon need to be part of this? Or they're healing wonderful, they're healing great, there's nothing to be alarmed about, and, send them on their way and tell them to give you a call if they need you. So it's really important that you understand the continuation of care that you are meant to provide. Your job as a PA, and especially a surgical PA, is someone who can see the patient from start to finish and really extend the abilities of the physician and surgeon so that you're doing more routine care follow-up so that the physician can take care of a little bit more complicated issues. Now, that's not to downplay the role of a PA, because in a clinical setting, PAs often run their own clinic. Like myself, I have my own clinic. I see my own patients. I don't have a supervising physician that just has his head right here the whole day as I'm seeing patients. That wouldn't make any sense. It wouldn't help the physician, and it would undermine my abilities. So hopefully, you don't think that I'm trying to downplay the role of a PA, saying that we get to see the less complicated cases, but it is the case. Physician assistants are designed to take care of the patients that are, within their scope, that are a little bit easier to see, and then as needed, they involve the surgeon or the physician to add to the care of that patient. There are physician assistants that do surgery full-time. That's what they do. I've met a couple of those that all they do is surgery. They don't see patients in clinic, maybe a little bit of contact pre-operatively, not a lot of post-operative care. Their job is to operate with the surgeon. So if you're an operation junkie and that's where you want to be, there are jobs available where that's all that you do. For me, I like the balance of surgery and actual clinic work as well. So for me, I chose a position where I could strike a good balance. Again, if you're hoping to be the lead surgeon, you probably wouldn't be happy as a PA. So if a surgical PA is something that you're interested in, I would highly, highly, highly recommend that you spend some time shadowing PAs in the operating room to see exactly what their roles are and see if it would be fulfilling for you. If you have any other questions, please email me and leave comments like you guys have been doing. I know you will. You guys are really involved, so I appreciate it. Hopefully I get back to every one of you. If I don't, it's nothing personal. I probably just missed it and you just have a few things going on. So if you don't hear back from me and you really want an answer, just resend the message again, because I try to get to everybody, but I know I miss people, so nothing personal. Okay, hope you guys are having a great day. Thanks so much for watching. Bye.